The first thing that really drew us to Fairbanks was the outdoors. The outdoor activities here, as I'm sure you're aware, are just amazing. And, Fairbanks is a great town. And it wasn't just one thing that drew us to Fairbanks. It's really the whole package. We like the people. When we've come up and visited, the people have been fantastic. And, the outdoors obviously are amazing, but there's also a lot of other stuff that just really fit my family well. It's nice to have a college in town. There's a lot of great things that a college brings that we like. We like all the food, and, going around and, looking for mushrooms, for example, is just fantastic. There was other stuff that was like, the high schools have a rifle team, and I think that is awesome. And this is the kind of place that I want to raise my kids. I was born and raised in Central Illinois, and I ended up going to college in Central Illinois also. Growing up, we did a lot of hiking and camping and hunting, and we really tried to be outdoors as much as we could. After college, I wasn't totally sure what I wanted to do, so I joined the Peace Corps, and I went to Ghana, and I was a science teacher there, which was a lot of fun, and I liked teaching. But I decided at that time that I wanted to become a doctor, and so after Peace Corps, I applied for medical school, and I met my wife shortly before medical school, and we got married after about the first year in medical school. We had our first of our 4 daughters at the end of medical school, only about a week and a half before residency, which was a pretty crazy time. We had 3 more, so now I have 4 girls. And ever since then, I've just tried to become a good dad and a good doctor. I finished my residency back in 2013, and after that I've been a urologist in Illinois and Wisconsin. And when I was in the Midwest, I did a lot of general urology, but at those positions too, I sort of subspecialized and focused heavily doing a lot of kidney cancer, kidney stones, especially the complex kidney stones, and BPH. Those have been kind of my 3 main areas, on top of just the straight up general urology. Urology is an interesting field. It's got a nice mix of clinic and surgery, and the clinic is great because you get a chance to really sit down and connect with your patients. But the surgery is fantastic. I did a lot of construction work when I was in college and high school even, and I always liked working with my hands, and it's very satisfying to do things with your hands. And surgery is very satisfying because you see concretely, that you're doing something positive for somebody. You can take away a source of pain or anxiety for a person. Urology, despite being a tight specialty, actually covers kind of everybody. I'll see men coming in commonly for troubles with peeing, and sometimes that's, just benign prostatic issues. Sometimes men come in because of, cancers, and women too. Women we see a lot of for troubles with leaking of urine or maybe chronic infections. Those are kind of the main classic types, but everybody can get a urologic problem.